Because we can see some things better in some of the cats, we're going to go through all the cats, okay?
Do you
all
want
right.
to introduce yourself? Or?
No.
Okay.
And I don't want to be in it either.
So just keep your hand.
All right, yeah. All right, so, yeah, I mean, you got to think like animal rights organizations. I don't want my name. I don't want my face, my name in any picture or any video.
This is Doctor. I don't know.
Right?
Yeah.
All right. Okay, so we're talking about the heart here, right? And the heart has 4 chambers. The first one being the right atrium, feeds into the
Right
ventricle. And then we have the left atrium,
left
ventricle. This tip over here is going to be called the apex. We have a vascular blood supply to the heart, which is called the coronary circulation with the coronary arteries and veins, which we can see here on the surface of the heart. We're looking at that anterior view. So we have the anterior sulcus or interior interventricular groove or sulcus. Right. So then we're going to follow going from the left ventricle. It's going to go into what structure? The left ventricle is going to pump into the
pulmonary drum.
No.
Left ventricle,
aorta, right? It's going to go into the aorta, and what valve is it going to pass on its way? The aortic valve, right? And it's going to go into the aorta, and then we see this turn here. This is called the aortic arch, right? The aortic arch is going to have a few branches off of it, which it's college football season BCS, which stands for the brachiocephalic. Yeah. And this is our left subclavian coming up over here. Here we can see the anterior vena cava in the cat. In blue. So if we follow the brachiocephalic, or left subclavian, which one is going to feed into the arm? Brachiocephalic. All right. Are we sure?
Isn't it subclavian?
Subclavian, right?
Yeah.
It's going to be a subclavian. It's going to come over and around the armpit area. It's going to be called the axillary, right? And then when we get into the arm, it's going to be called the brachial, which we're going to see it a lot better in some of these other cats over here. Here, what organ is this? Kidney, and we can see the renal artery and vein coming into the. So this is so here we have the what structure is this one going to be? That's going to be draining blood, inferior vena cava, right? And what's going to be running along it or near it? The what? We have descending. If we follow this this descending aorta.
Abdominal aorta.
Yeah, and what cavity is this? Thoracic. Going to be the thoracic aorta, descending aorta. Once we get past the diaphragm, then we're going to be into a new cavity called the abdominal cavity, and then it's going to be called the abdominal aorta as it goes down, right? And we can appreciate that coming in here. And then we get in. Now we lose it kind of here for a little while around the pelvic region, but we pick it up again in the leg, and this is going to be called the femoral, right? And good enough on this cat. We're not going to get much more out of him. So let's take a look at this cat. All right. So this again. Now we're looking at the at what chamber?
Right atrium.
Right atrium.
Right ventricle.
Right ventricle. What's the valve in between them?
Tricuspid.
The tricuspid, right, or the right AV valve, either one. This structure here's
the apex.
Apex. That means we're looking at the
left
ventricle, and then the left atrium. All right. We can see coming out of the left ventricle. We can see the structure called the. What was the left ventricle pump into? Aorta, right? And then we have the aortic arch, which it's not as clear on this one, but we can still see the 2 main branches coming over here on this cat, the brachiocephalic and the left subclavian, right? And then we can kind of see the system coming into the arm here again. Around the armpit, it's going to be called the axillary, and then here in the upper arm is going to be called the brachial, and then we kind of lose it on this cat, but we'll pick it up again on one of the other cats. All right, so what are we missing on this one? We can see how it looks down here. We got a nice supply of our renal circulation coming in here, and then let's see if we can well, we can see the descending, in the inferior vena cava there. And then we kind of lose it again, so we get to the legs, and again we're at the legs. We're looking at the, the femoral coming down here. And let's go take a look at this. Now skip this cat. I haven't seen this one yet. Let's go this cat. Here we have the. 3D. Yeah.
You imagine just like slapped it on my phone, just like
magic trick. Alright, this
oh, there's a heart.
Alright, so we have again the left atrium. It's going to be receiving blood from the systemic circuit through the ascending aorta here. This is the right ventricle, the apex left ventricle. We can open it up. We can see the left ventricle, the right ventricle atria. There. Okay, then here let's follow this up into the arm, and we're going to be looking at the what blood vessels do we have in the arm here, in the forearm? We have the down here. Ulnar and radial, right? The ulnar and radial. So we can see here, and they're going to come together to form the radial and ulnar vein are going to come together and form the brachial vein, right? To bring that blood back here towards the heart. And then if we look underneath here, we can see again nice kidney and that renal circulation. The hepatic, we can kind of see buried in here a little bit. And follow this inferior vena cava. We can come down here and pick it up again in the legs, where we have again the femoral coming down here, and then leading towards our tibial, right, which will then lead to the foot. All right, so that'll wrap it up for the cat. No, hey, no.